today, the strategy is called, I call it focusing the breath. And what you're doing here is you're actually thinking about breathing to the pain. So it's a concept that works for a lot of people, but sometimes it won't work. And I was talking yesterday about how some of these strategies that we're going to go through are going to really click for you. And you're going to be like, yes, that one is perfect for me. And some of them you're just not going to click with. And that's normal. That's great. I want that for you. That's why we're doing so many different strategies. So today we're talking about breathing, focusing that breath. And what that means is as you are breathing, especially during that exhale, I want you to think about softening the pain, the contraction, the feeling. And a lot of times you hear this done in if you have someone leading stretching, if you are part of a yoga class, sometimes you'll hear the concept of breathe to that spot, breathe to, maybe you have tight hamstrings or something, and they'll say, breathe to the tightness. So it's the concept of kind of visualizing that your breath is going to soften that pain, soften it. And it's just another idea, another way to kind of focus our mind on this task and to not let our mind go down that rabbit hole of this hurts, this is in pain, I don't like this. That is where we don't want our mind in labor. We don't want our mind to be thinking about, is this almost over? I don't like this, because that doesn't help the whole process of labor, which is the opening, the allowing, and the work of labor. So when we practice, I'd love for you to just, probably what I would say the best thing would be to visualize where you would feel a contraction. So, below your belly button, kind of where you might feel menstrual cramps. That is a great spot to visualize. But if you have any pregnancy discomfort right now, if you have, symphysis pubis pain, if you have, sciatica pain, or any kind of heartburn or anything going on right now, there's a lot of pains that can happen in pregnancy. Then I invite you to choose that spot to practice your breath. Okay. So again, other things just to remember, we can still kind of start with some relaxation, like we learned yesterday, some kind of the first few breaths. Maybe we think about relaxing our body, because remember, when we are nice and loose and relaxed, especially when our bottom half is relaxed, our butt's relaxed, we can allow that contraction to happen, that contraction to do more work. So I would say the first 2 breaths, let's just focus on that relaxation. And then the next 8 breaths that we practice, let's think about breathing to that spot, breathing to a painful spot. So pick your spot and let's practice together. And I'm also gonna, I'll do the partner hands for a few, so you can see that's sort of building on what we learned from class 2. And again, it might feel silly to practice, but the more you practice regularly, it's going to really set you up for success. It's going to make that feel so normal in labor. And that's what I want for you. Okay. So let's start with just a cleansing breath. Ready? Okay. Nice breath in. So we're focusing on that spot. Breathe right to the spot. one more. Okay. I'd love to hear your thoughts on this strategy. Did it feel like something that you could imagine working for you? Sometimes it is hard if you don't have any pain to practice some of these strategies because it's kind of like, I don't know. I mean, I guess it's working, but I don't have any pain to like see. But you can use these breathing strategies before you go into labor. So one of the things I wanted to mention, I was, talking to a student yesterday about vaginal exams and how they can be very intense, sometimes painful. And I reminded the student that though you can use your breath for that as well. So if you are undergoing any type of procedure that might be intense, that might be painful, use this breath, practice this breathing. Just like say to yourself, okay, I'm going to breathe through this. And, it is so, gosh, it helps so much than being, tense and having that tension. The more tension we have, the more pain we feel. And then that increase of pain, that pain increase can increase fear, which increases tension. It's that whole pain, tension, fear cycle, which is something that we want to break. We want to break that cycle so that we can reduce that pain. Okay, so as a reminder, if you practiced breathing through your nose or your mouth, anything is fine. The whole point of it is to try to have a big inhale and a nice, slow, gentle exhale. I really appreciate your time today. I really appreciate you joining me. And I look forward to being with you right back here tomorrow as we dive even deeper into using your breath for labor, building the strategy, and I will see you right here tomorrow. Thanks for joining today. Bye.